Hey everyone, I'm Dr. Mache and welcome to Facebook Live and Ask Dr. Mache. And tonight we're going to be talking about a topic I think is very important that I want to try and reframe for you a little bit, and it's called menopause. When will it end? A lot of people ask me that question. When will the symptoms end? When will this end? So let's talk about that, and I want to do it. For those of you who don't know me, I'm Dr. Mache Seibel. I'm a member of the Harvard Medical Faculty and author of The Estrogen Fix, best-selling book. And I am here tonight to what I do every day, and that is to help you figure it out so that you don't have to tough it out and you can live a healthier, happier, and more hormonally balanced life. So that's what we're going to do, and I really want to talk with you and ask you to share this with people as you, friends that you have, share this and let others come in, because I want to try to answer as many questions as I can and to help you as much as I can get the information that you need. So I want to tell you a little bit of story, just very briefly, just about how I got started in this. I began my career as one of the country's leading infertility experts. I actually did one of the first in vitro fertilizations in the country. I even helped people, I even helped gorillas get pregnant at the zoo. And about 2002, a study came out called the Women's Health Initiative that caused a great deal of confusion. It basically said incorrectly that estrogen caused breast cancer, heart disease, dementia, and a whole lot of other things that have turned out not to be the case. And I explain that more to you about that later. And only a few months after that, my wife had surgery that threw her into early menopause. And her doctors, having just seen this study come out, were reluctant to treat her. So I switched from my infertility work towards menopause to help her figure it out, because I didn't want her to tough it out, and I don't want any of you to tough it out either. So that's the reason that I'm in this and why I'm so passionate about it. What I want to do is I'm going to be sharing information about menopause and when will it end, and let's talk about that right now. So let's get started. A lot of people will say, you know, when they ask me when will menopause end, what they're really asking is how long will the symptoms last? So I want to talk about that first, because I know that's what's on your mind the most. For instance, you may be wondering about hot flashes, or you may be worrying about brain fog, or confusion, or insomnia, or palpitations in your chest, or other conditions that are bothering you personally. So how long do the symptoms last? Well, of course, the answer is always, it depends. But in general, on average, the symptoms of menopause are most intense in the 2 to 3 years before menopause and the 2 to 3 years after. So about 3 to 5 years, 6 years are the bulk of the symptoms. Now, menopause, just to be sure we're talking about the same thing, is the 1 year after your last menstrual period. So that is the medical definition of menopause. So 1 year after your last menstrual period. Now, in that set of conditions, in natural menopause, the symptoms will begin 2 to 3 years before, but they can start up to 10 years before. And they may continue up to 10 years after. 10 years after. And an unfortunate few, about 7.5% to 10%, symptoms will continue even longer. But for most, the symptoms will stop 2 to 3 years after the last menstrual period. Now, when I'm talking about symptoms, what I'm talking about are the hot flashes. I'm talking about some of the brain fog, the mood swings, maybe anxiety, maybe it's a little sadness and depression, unless it's shifting or drifting you into serious clinical depression. So That's what I'm talking about. But I do want to be clear that it's not until 2 to 3 years after menopause that the majority of women start to get some of the more significant symptoms that bother them. One of those is vaginal dryness and painful sex, and that often happens 2 to 3 years after, when estrogen levels have gone down and the tissues in the vaginal area start to shrink and shorten so that the vagina doesn't stretch as much. Because remember, a baby came out of there for many women, and whoops. All right, can't hear me. So Kimberly is saying, is anybody else having a problem with hearing me? Let me know so I can, I'll change what I'm doing. I'm using a headset and speaking through that, but is anybody else having trouble hearing me? Because if so, I'm going to take this headset out and just use the phone. Let me know. Kimberly, can you hear me now? Are you able to hear now? You wouldn't know if you can't hear. Okay, let me, okay. Okay, can you hear me better now with the phone? Oops, there's a nope. Can you hear me now? Feel like a Verizon commercial here, but hopefully you can hear at this point. Yay! Yay! Oh, it's a bummer to be talking and then not be heard. Okay, Kimberly can hear. Awesome, thank you so much. Well, what I was trying to say is that Linda, yes, Angelina, yes, Wendy, better. Okay, super. I'll talk up as well. So the story is this, is that what happens is the symptoms that are the most worrisome for many women, the hot flashes, the palpitations, the brain fog, the mood swings, the insomnia, those things start to really intensify as you get closer to menopause. They may start up to 10 years before, but they intensify in the 2 to 3 years leading up to menopause, and they continue pretty intensely for the 2 to 3 years after menopause for most women, and menopause is defined as 1 year after your last menstrual period. Now, what ends up happening is at the same time, there are other symptoms that don't start until later, and you may be unaware of them. For instance, the vaginal dryness that happens, because as estrogen levels go down, the tissues in the vagina, which are using the estrogen to stay elastic and to be able to stretch if you should have a baby, or to be able to stretch if you have intimacy, those tissues suddenly, without estrogen, over 2 to 3 years narrow and shorten, and that's what causes the dryness and the pain. The secretions don't come. So some symptoms, like vaginal dryness, don't really kick into gear most intensely until 2 to 3 years after menopause for most women. Some are going to get it earlier, but others are not going to start until later. So that may not happen, but don't forget there are other things that are silent. For instance, osteoporosis, thinning of the bones. At the time of menopause and in the 2 years after, you can lose up to 30% of your bone mass in the 2 to 3 years after menopause if you're not treated, if you're not on estrogen, if you're not taking calcium, if you're not doing exercise, particularly weight-bearing exercise. So those symptoms go longer and actually will continue for the next 5 to 7 years. And it's really important that you be aware of this and be proactive on it. Another is your heart. You know, women are worried about breast cancer, and understandably, breast cancer is terrible. But the thing that's going to kill 10 times the number of women is heart disease. And heart disease begins to intensify in the years after menopause silently, because without estrogen, plaque builds up in the arteries, and that leads to narrowing and hardening of the arteries and puts you at risk for a very significant disease, which is much more likely to kill you than breast cancer. Also, I want to say in terms of the osteoporosis that a woman who has osteoporosis or who is 50 years old and who is healthy has the same chance of dying of a broken hip and a consequence of osteoporosis as she does of breast cancer. So realize these are serious, serious health issues for you. So let me stop there for a minute and ask if there are any questions, because I want to start addressing questions and not talk too long, give you time to ask the things that are troubling you in terms of your symptoms or how long they will last and so forth. Because it's a good opportunity to ask questions about the symptoms that are most troubling you. One thing I want to mention is a lot of women who are, well, I'll take a moment just to say that coming up very soon, I have a new book coming out. It's called The Estrogen Fix, and it is a book that explains hormones. It tells you about the timing of hormone, when to take them, when to replace them, how much to take, what dose to take, how long to take them, and so forth. Well, let's see. Christina is asking me, wait a second. Andrea is asking here, how long do I need hormone replacement? There's one that I know that was right before. Okay, let me address them in order. Tammy Kelly asked, can osteopenia be reversed? Okay, here's the good news and the bad news. If osteopenia means thinning of the bones, it means you're losing bone, and the good news is, yes, it can be reversed, but here's the point. It's all about timing. If you start hormone therapy within 3 years of menopause, you can reverse it completely and put the calcium back in your bones. And I talk about this in the Estrogen Fix. On the other hand, if you wait until 7 years after menopause, you can't replace the bone. It's lost. What you can do is you can prevent further loss. So the sooner you start, the better. And exercise and calcium and checking your vitamin D levels, all very important to help you prevent that bone loss. That's what you want. Remember, you're only building bone until you're about 30 years of age or so, and after that, bone starts to come out. So it's only in your most useful point of your life that you are building bone. So continue to eat, and if you have children, particularly if you have daughters, get them to drink their milk, take their calcium, eat their vegetables that have calcium in it, and so forth. Okay, Andrea is asking, how long do I need hormone replacement? A lot depends on your age when you started. So if you're a woman in early menopause, if you went into menopause before say 45 or other, remember 5 to 10% of women go into menopause before 45. The mean age is 51, but a lot of women are going into menopause earlier. Maybe they go naturally into menopause, or maybe they're having surgery because they have a gene for a certain cancer and they're having their ovaries removed and they're going into surgical menopause. If that happens, you need to keep that estrogen going from the time of that early menopause all the way through 51 years of age at least, and longer. And then it depends on you and your doctor. I know when I'm coaching women and they contact me to try and help them with these kinds of things over the phone, what I do is I have to be sure who they are, what their background is, their risk factors, and then individualize a little bit. But generally you can keep safely taking it between 50 and 59 fairly safely for most women. And I would encourage women to consider staying on it for that window of time in general, realizing everything is individual. Let's see. Hot flashes, when will they stop? Hot flashes are rough, and they can be a real bear. Hot flashes in general will last 3 to 5 years, like I was saying earlier, maybe 6 years, but there are some women who will have hot flashes for 10 years, and there are a subset of women who will have hot flashes longer, so they can even continue beyond the 10 years. I do have a gift I can give you to help you with that. If you go to hotflashgift.com, hotflashgift.com, I've got a free thing there that is 10 mistakes that prevent you from, let's see, yes, hotflashgift.com. If you go there, I have a gift that's 10 mistakes that trigger hot flashes, and it will help you avoid those hot flashes. But hot flashes are a real pain, and there's a lot of things that you can be doing to help yourself lower the heat, and that continues to be something that you can change and modify and to improve hot flashes. But they can last you for a very long time for some women. Let's see. Glenda Jeffries, hi. I just got a positive pregnancy test and a high HCG. Of course, I'm not pregnant, but is it serious? Okay. Well, this, again, depends. I don't know your age or your history or anything about you, so let me just say, if you're not pregnant and you have a high HCG, there's a lot of things it can be. One thing is it could just be menopause, because some tests are not very sensitive, and HCG and the hormone LH are only 33 amino acids different from each other. So some people will get a high HCG and it's actually LH, and the test is not a very good one in that laboratory. So I would repeat that test if you know you're not pregnant and your HCG is positive. You want to get that done at a good laboratory. The second thing is there are some tumors that produce HCG, and that needs to be evaluated. So it could be an HCG producing tumor. So if you have that, you need to talk with your provider there, your healthcare provider, and make sure what's going on with you. Is it just a cross reaction of the HCG with a different hormone, so it's falsely positive, or is it really positive and it could represent a tumor? So you need to find that out, and I would recommend looking into that sooner than later, so you know, A, and B, so you're not worried, because it shouldn't be high in a non-pregnant woman. Let's see. Tammy says, thank you, and thank you for joining. And remember, please share, because I let other people know. Put it on your Facebook page and share it with others. Christina, thank you, and thank you so much. Just shared your video, Christina said. Let them know you appreciate it. I do. And I want to tell you that my goal is to reach as many women as I can to help them figure it out. And so thank you so much for sharing it. Other questions that you have, because these are very important things you're asking, and I know that they have information that will help many of the other people who are not saying anything now, but who are in fact benefiting, and I so want to help you with this. I want to tell you too about, if you are wondering how your symptoms are affecting you in menopause, I want to tell you something that I have. It's called Menopause Quiz. It's available at menopausequiz.com. This is a free quiz. It takes about 2 minutes. You get instant feedback, and it tells you how the most common symptoms of menopause, how your symptoms are affecting you relative to other women. So it's menopausequiz.com. So check it out when you get a chance. Now, let's see. Glenda's asking, 52, do high HCG levels indicate cancer? Let me say that I don't want to say what it indicates, but there are some tumors that are cancer that do produce HCG, and that's why if your HCG is really high, you've got to be sure that isn't it. Those are uncommon cancers, but they're not non-existent cancers, and so you must find this out. And tomorrow, just talk to your healthcare provider, your doctor, and get to the bottom of it. Why is it high? And why is it up at 52? Now, you could be pregnant. Maybe, you never know. Every once in a while I have what I call an oops baby. And, they weren't planning on it, but oops, they're pregnant. So, hey, it's possible. So don't rule it out completely. It happens every year about once. Some lady will come in and they're, early 50s like you, and that's what happens. So, there may be a pregnancy there. Sherry says, I've been having panic attacks for 3 weeks now. Seems like humidity triggers it. I'm 49, have never had these before. Let me just say that in menopause, in perimenopause, in that window when the symptoms start happening, that is a time when you really do get a lot of emotional symptoms. It's very common. Anxiety is one of the most common. Usually people who've had bad PMS will be at more risk for the panic attacks and for depression and sadness. But I will tell you that it certainly is possible that it's simply to do with this perimenopause shift that you just experiencing. Keep an eye on it, talk with your healthcare provider, and make sure it's not something else that's going on. Let's see. So Sherry's asking, could they be from menopause? And yes, they can. So Andrea is asking, Andrea Kathleen is saying, she's saying, good luck, Glenda. And I will say, yes, indeed. We certainly want to make sure you get taken care of. Eva is asking, how can you I don't quite understand, I can't read it. How can you cartilage issues at the age of 55? I'm sorry, I can't understand the question. If you would be so good to rewrite it another time, maybe it's the spelling that I'm not understanding, Eva, and I'll be happy to try and address it. But I don't quite understand what the question is. So Christine is saying, good luck, Glenda. You're in my prayers. Absolutely. Well, maybe it'll be an oops, baby. You never know. So, other questions, because I want to try and help you as much as I can. And again, please share this with others. And I would be delighted to have other people on. Let me tell you let me remind you again that if you go to menopausequiz.com, you can take the 2-minute free quiz and get an idea of where your symptoms are compared to those of others. And it's a really great way to find that out. And also tonight, I'm going to be, I want to offer you another free gift, and that is, if you go to my website, drmache.com, Estrogen Fix, CH1, Chapter 1, I'm going to give each of you a free chapter of my book, the first chapter, drmache.com, Estrogen Fix, CH1 for Chapter 1. So I'm giving that to you so you'll get an idea of what's in it. And even in that first chapter, you're going to gain a lot of great information to help you with the very questions that you're talking about. This is really crucial information for women to know. Let's see. Oh, Christina, thank you. And someone else who's not listed here just shared the video, and I really appreciate it. Thank you so much for doing that, because that's why we're here. And so thank you so much. Other questions. Wanda says, I have high blood pressure. Can menopause make it worse? You know, what happens is menopause per se doesn't make blood pressure worse. But what happens at menopause can. Because what happens, people gain weight. People start to get a little bit of higher blood sugar. People start to get more sedentary. They don't exercise as much. People have issues that creep up on them. So menopause doesn't make it worse, but the timing of menopause in your life can make it worse. And a lot of time, exercise and changing your nutritional intake, your foods, can lower that tremendously and get rid of the high blood pressure. And that is something that you want to do if you can, because then you won't have to take the medication. Uh, let's see, Christine, I'm not sure of the question there. It's talking about the springs they put, so I'm not quite sure of that question. Eva is asking, other than Kegels, what can be done at the age of 55? I'm going to assume you're talking about bladder sensitivity, and because Kegels are sometimes done to increase intimacy and to make it better, but Kegels is the exercises when you go to the bathroom and then you try and squeeze the urine off and you squeeze the rectum, and those muscles that contract that usually will stop the urine from leaking. And so what happens is it's important to, first of all, make sure there's no bladder infection if you're having loss of urine. The second thing is there are people like your gynecologist, and sometimes there are special gynecologists called urogynecologists, like urologists, but a gynecologist. They're actually gynecologists that have taken an additional couple of years of training just for bladder symptoms. And there you can have an evaluation. There may be foods that you can avoid that are making your bladder more sensitive. There may be treatments that you can do that are non-surgical. There's now some physical therapy things that can be done that are able to use small electrical vibrations to stimulate those muscles in the bladder and the vagina. They are really effective, and in a matter of 2 months you can cure this stuff. So talk about getting some treatment with this kind of therapy with your doctor, your gynecologist, your primary care, because someone near you probably is doing that, and it can really help. Even saying Kegels for tightness. Okay, so in that set of conditions, you know, Kegels are really good, but depends on why the muscles aren't tight. So it could be that you need, sometimes people do need surgery to try and change the anatomy a little bit and tighten it. There are some laser treatments that are being done now to cause the vagina to be tighter, and sometimes estrogen locally in the vagina will thicken the tissues and make it better. I can't say more than in general because I don't know your details. But these are things that you can talk about, you should talk about with your healthcare provider. And if they can't help you, what you want from them is a referral to the right person who can help you so you can get it taken care of. Let's see. Christy's saying, what do you think about Assure the springs they put in your tubes? I've had them since 2005. Well, all I can say about that is if there's something that's going on, the trick is that you have to find somebody near you or get a referral from your doctor for someone who is used to dealing with that, because putting things in, I'm assuming that you're talking about a type of birth control that goes into the fallopian tubes to plug them up so you don't get pregnant, and now they're causing you a problem. So it really requires, that's a very specific thing. And sometimes they can go inside the uterus with a little telescope, a very thin telescope, and pull them out. So it really depends on the situation and what was done at the time. But talk with your doctor or talk to the person who put them in and see if they can help you with a solution. I don't know the problems you're having or what, but clearly, if something is bothering you like that, go back to the person who put them in or talk with your doctor about who might know how to help you with this specific thing, depending on the symptoms, because I don't know enough about the details of your particular case. But I would start there, and probably they're going to be able to help you. Eva says thank you, and I appreciate very much that, and happy to do so. And Christina says yes. We have time for a couple more things. If you have questions, let me know. I'd certainly be happy. Um, Christina says, not have any problems yet. Wow, you know what? That's awesome, and I hope that lasts for a very, very long time. The trick about all this is to be proactive. You know, with this, I want to tell you one thing. We've had this terrible hurricane going on in Texas, and the thing is that my mom's down there. She's 93. As a matter of fact, her birthday was yesterday, and so we were trying to make sure she's fine and she's in a safe place now and great, but she ran out of medications. So I'm telling you one thing is you should always have enough medication so that you are not caught short in some kind of a catastrophic emergency. Sherry said, would IUDs give you enough hormones to get you through menopause? So the hormones usually in menopause that you get from an IUD are progesterone, and they are things like the Mirena that is inserted in the uterus and gives up progesterone. So when it talks about get you through menopause, they last for about 5 years, and they can protect the lining of the uterus, but they are not going to give you the hormones you need to, deal with your hot flashes or other things. It's just not for that. What they're great for is they're able to help you protect your lining if you have a uterus and you want to take estrogen, so you don't have to take an additional progesterone pill. So that's an awesome use for it, and one that you can use that way. Kim says, I'm 54 and have started menopause. How long will I go through it? And as I was saying, Kim, at the beginning, most women will, when they start going through those symptoms, they last for about 3 to 5 or 6 years, but they can last a heck of a lot longer. And as I said at the start, if you weren't here, it's the silent ones you have to watch out for, the changing in your bones, the changing in your arteries in your heart. Those kinds of things go on and may not even start intensely until 2 to 3 years after menopause. But the active ones, like the hot flashes and so forth, for most people, 5 or 6 years. Christina, you are very, very welcome. Kim is saying hello from Idaho. Well, hello to you. Welcome. And Wanda is saying, I barely eat, so frustrated with all this weight gain. Weight gain is a real big issue, and we've done other Facebook Lives on it, and that's a whole subject that I can't go into now. We don't have time, but I do want to say that weight gain is very frustrating, and it has to do with many, many things. Not sleeping enough, and hormones that you produce increase your appetite and make you hungry. Being stressed because it increases the hormones that cause belly fat and that jelly belly that happens. Not exercising enough. These are things that don't burn the calories and give you the muscles that burn up more sugar than fat does. And finally, nutrition and the foods that you eat. And a lot of times people will drink more wine when they go out with their girlfriends. They'll split a bottle of wine and so forth. That's a lot of calories. The food choices, the processed food. So even eating more vegetarian will help with the weight control. More of the exercises, and estrogen is very helpful for weight control. It helps you in terms of keeping the fat from migrating to your belly. It makes every single fat cell store more fat instead of booming out more fat cells. It causes your muscles to consume more sugar. So all of these things can be helpful. But another time I'll be happy to discuss that more in detail. Eva's saying, yes, oh, you're there in Houston. You're talking about what is the best soap to use, extremely sensitive lady parts. Well, you want to have the ones that don't have any deodorant or any scents in them. The things that are the smelling, the antibacterial, all of those kinds of things. You want it to just be plain soap, maybe just Dove. I know that there is a line of products that are coming out now from the I'm trying to remember the name, but there is a new line of products that are coming out, and I'll tell you what, I'll come back to your question and I'll put it in, and so that you'll have it. But I hope you are staying dry there in Houston. I know it's tough. I mean, I have some of my friends and relatives that are living in the second floor of their houses, and it's just a mess. It's so sad for all the folks that are struggling down there. Kim is asking again about the weight gain, and I was addressed some of that before. Kim is saying she's on Nutrisystem. That can be a helpful thing to do, but again, you've got to do the exercise, you've got to cut the stress down, you've got to get enough sleep, and estrogen can be very helpful. Walking, Christina, is a great thing, and the vegetables are great. There was an article published just last week in the New England Journal saying that even if you're 65 years old and you start changing your diet to be healthier, you substitute more veggies in instead of processed foods and saturated fats like meats and so forth, that people are living 5 to 8 years longer as a result of changes that didn't start until they were 65 or older. So this is a lot that you can do. Tammy's asking about help with sleep. And again, sleep, I'll give you a very quick on that, and then we'll bring it to a close, and that is this. Some of the things that help. I mean, first of all, I'm going to say again, hormones are very helpful. Estrogen helps increase your rapid eye movement sleep. It's very helpful. But Kendra, there's no estrogen pills over the counter. It's all prescription, so that's important to realize. But for sleep, you want to have a standard bedtime, room darkening shades, downgrade your activities. So when you get within 2 to 3 hours of sleep, you want to be able to stop and turn off the computer, not watch the TV. Before you go to bed, there's a thing that you sort of think about what you did last. So if you are somebody that's watching the news and all there's nothing good on the news, unfortunately. It's all so depressing. So if you're watching the news late at night, you're watching the murders and missile launches over Japan and whatever else is going on, flooding in Houston, it's sad. So it makes you anxious, and it's better to read a book that you enjoy, listen to comfortable music, take a nice warm bath, pamper yourself a little bit later at night. Talk to friends who you really like, not people you know, people you like and know. Keeping the room a little cooler. Keeping it like 68 degrees is best for sleep. If you start to do those kinds of things, if you have a thought at night when you go to bed and you want to not forget it, so you're up all night trying to not forget it, I always keep a pencil and paper by my bed, and I write down what I was thinking about, and when I get up in the morning, it's on that piece of paper. So I'm not trying to stay up all night thinking of, I won't forget what I just thought of. So that's called docking your thoughts. So dock it on the nightstand. So those are things that you can do. So before we go, I want to remind you again, for the hot flashes I mentioned, if you go to hotflashgift.com, you'll get a download there, and it'll be 10 mistakes that people make commonly that trigger hot flashes. That'll be helpful for you. Also, if you would like to see where your menopause symptoms are affecting you, menopausequiz.com is really very helpful. It's a 2-minute quiz, and it'll give you an interactive quiz where you put how much you're affected, and then you'll get instant feedback on the what to do, and that will be helpful for you. And finally, I'd like to give you as a gift the first chapter of my new book, The Estrogen Fix. And if you go to drmache.com Estrogen Fix CH1 for Chapter 1. You'll get a free download of the Chapter 1 of my book, which you're going to find very helpful. It's got a lot of great information. And this book has been reviewed by many people, some of the top docs in the country, and has been given rave reviews, but also by the North American Menopause Society, which is recommending it not only for the women, but also for their doctors. It's very well documented and gives you the references. If you want to look them up, you can, but they're all in there. So I want to thank you again. I want to tell you that if you have a particularly big challenge, I hope you will share it with me. I want to address the things that are worrying you, because if you can figure it out, you won't have to tough it out. And that's my goal for you. So I'm Dr. Mache, and I want to wish you a good evening. And remember, it's better to stay well than to get well. So stay well, everyone. And thank you so much for taking time out of your evening to join me on Ask Dr. Mache on Facebook Live. Take care.